Because believe it or not, your nails can hold a lot of clues about your overall health, especially if they turn unusual colors. And to help us decipher what the colors of your nails mean, we have dermatologist Dr. Susan Evans from the Cosmetic Physicians of Beverly Hills here, as well as Alina. Thank you both.
Sure, you're absolutely right. We've seen thousands of patients. Sometimes you're not exactly sure what they have, and your nails, believe it or not, can give you an indication of what's going on inside your body.
Because nails can get funky.
Yes, they can. And if you see a change, then you should make sure to get it evaluated by your physician and make sure it's not a sign of something more serious. We'll start here with this one that essentially is white. It's far more than you would expect, like a U shape at the base. It's actually going apart. This can mean liver problems. You have this one here with a stripe going down that's pigmented. This could be a sign of something serious like a melanoma or a skin cancer. In addition to that, this yellow nail, if you see changes like that, this could be some problems with the lungs and emphysema and things of that sort. You can also have like a pink and white nail where it's white at the base and sort of pink at the top. Believe it or not, this could be associated with kidney problems and renal disease. This is an example of pitting and some changes or lines associated with psoriasis.
Because I was cheating before we started, and I was seeing some pitting in these nails here. And so...
Pitting, scaling, and yes.
And you were about to say that pitting is associated with a skin condition called psoriasis.
Absolutely. Psoriasis, which is an autoimmune problem where your body is actually fighting off the skin cells. And typically you have it in the knees and on the elbows, but you get a thickening of the top layer of the skin. It looks scaly, it looks silvery, like a reptile.
Do you have any symptoms like that
I do.
elsewhere? Where do you have those?
Most of it is on my nails, but some of it on my fingers, which is painful, and as you can see,
we have a picture, I think, of your
cracks.
hands when you had a few of these outbreaks,
my
too.
nails crack,
Right.
and my fingers crack, and just a lot of dryness. And
Typically, it was hard to put creams on. It was so thick that the creams couldn't penetrate. We had to take other medications by mouth that had a lot of side effects associated with it. But now we're able to treat it with a laser.
And we've got a laser here,
we
so
have
let's
it here
let's
today.
try this out. And so the whole idea with this laser is you're trying to penetrate those heaped on layers of scaly skin that people with psoriasis have.
Exactly. This is a UVB ray that penetrates and actually removes the top layer. So what it's able to do with the help of this right here is focus on the specific area that she needs to get treatment. This treatment is not a painful treatment, but I just want to let you know that you'll feel this on 3.
okay.
Here we are. 1, 2, 3. How was that?
Felt fine, just a little bit of warm sensation, but
That's
other
good.
than
And
that,
how often would someone with psoriasis
awesome.
need to get a treatment like this?
You should get twice-a-week treatment.
Twice a week?
And oftentimes you should do it for about, say, 6 weeks, sometimes 12 weeks.
And then you'll see benefits
And the great thing
improvements.
about it, you actually get clearing. And this is for mild, moderate, and severe psoriasis. And the clearing can last anywhere from 4 to 6 months, and in some cases, for a year.
wow.
So we're going to finish up the treatment during the break. And coming up, if you have a question about your health but are not quite sure it warrants a doctor's visit, we may just have the perfect solution for you next.